Okay, so for those of you guys that don't know Dr. Linette is a traditional Western trained ER doc turned functional med. So she's got the best balance of both worlds.
So about my sins.
Yeah, well, you know what? It's good to
This
have.
is a conventional medicine.
It's good to have both because then you can understand the pros of one side and the pros of the other, and you can marry them together, and you can go from there. So, in my experience working with Dr. Linette, she's just very compassionate and understanding to each person's goals and what they're looking for. So it's not ever a one-size conversation from anybody that she's worked with from our team or from our community. It's just very personalized. It's like, what are you here for and what can I do to support you? I know Owen's had some really cool results with some of the ozone injections. So I'm just excited to learn more. I think there is, and the reason I asked Dr. Linette to talk on this topic specifically is there is a lot of bad medicine being done out there around PRP and things like that. So you have people getting PRP when they don't have the stem cells within their body for it to react, for even to do what it's supposed to do, or they're not taking enough blood to get the right amount for the PRP, or there's all different, I feel like there's so much misinformation, and you're a trusted source. So I'm excited to hear from you of like why different procedures and who would benefit from them. So,
Well, thank you.
yeah, you're welcome. Okay, so I'll let you take it away and we'll record this back here.
Alright. Well, good afternoon. I'm Linette Williamson. I used to be an ER trained physician. I worked mostly as an attending physician down at Kaiser in San Diego for a little over a decade, like 12, 13 years. During the end of that time, I made the transition to functional medicine because I started to realize that, one, I was going to burn out of ER, but also I was figuring out that there was just going to be there could be a better approach to how we're handling healthcare in the United States, especially. I was seeing 50-year-old patients. I'm 53. I was seeing patients that are in my age range that were coming out of nursing home. Wow. And it wasn't because they were quadriplegic and needed that kind of level of support. It was just your routine, just standard degeneration and aging, and that just can't be right. There's got to be a better way. My topic today is regenerative medicine. My goal today is to keep the presentation somewhat short, give you enough information to kind of understand the essence, and then I'm going to open it up for question and answers for any particulars or clarity that you guys might want. Regenerative medicine is starting to really grow culturally. You can just Google it and get a list of practices or therapies, and I chose a handful that are the biggest hitters out there today, and I do all of those therapies as well. How many people have heard of ozone therapy?
Before you knew.
Not until you.
All right. PRP, platelet-rich plasma, stem cells, exosomes.
Nope.
I've recently heard of exosomes that they're similar to stem cells, and I think that is being approved right now by insurance, or is it not? I don't know.
Exosomes?
Yeah.
Not to the best of my knowledge.
Okay.
Some insurances do cover PRP. I have seen people get it done even in an HMO system like Kaiser. How easy it is to get it, is it offered as it's probably not, I don't think it's as easy to get at Kaiser as it should be. And probably provider dependent too, as to whether or not it's even offered as an option. Who's heard of peptides? All right. What peptides have you heard of?
Nothing. I just know
Okay.
that peptides are popular.
Yeah.
Wolverine.
Wolverine.
Wolverine, yes. BPC 157, TD 500, yeah.
159, yeah, like
yeah. All right. Next slide. Well, before we
Can
get,
I turn lights up too, by the way?
Oh yeah, Ryan got it. Just so it's easier to see.
Yeah.
great. Before we get to the specifics of regenerative therapy, Part of my counsel, no matter what someone's coming to me for, whether they have an owie that needs help or they're really sick, such as Lyme disease, mold toxicity, or just hormones, lifestyle is the foundation. You need nutrition, you need habits, and what we eat and what we don't eat matters. And it can make all the difference as to how well these regenerative therapies take. The way I explain it to patients is that regenerative therapies are like general contractors. You want to build that beautiful custom luxury home on the cliff overlooking the ocean with all the high-end amenities inside it. Well, and you go and hire the city or the town's best contractor, the one person that everyone wants. But then you don't give them the proper materials, right? We've got to give the contractors materials, and these regenerative therapies are like general contractors. If you want a nice structure, you're going to have to give them the best materials to use. One of the things that I focus on is more of an animal-based diet. A lot of people, it's kind of trending now, carnivore diet. And I'm not, carnivore is one form of animal-based, and I'm not necessarily suggesting that, but the whole concept is that a lot of foods, plant foods, can have a lot of inflammatory plant defense chemicals that can create inflammation in the gut. And so a lot of these animal-based diet foods are lower in inflammation, which allows the body to have healing. Because part of the reason why people have degeneration in their joints or injuries that are difficult to heal is because they're inflamed. So unless you start calming down that inflammation, then a lot of these regenerative therapies, even some of the big hitters such as peptides or stem cells, are not going to be quite as effective. It's the visual I give people is like trying to fight your house fire with a blowtorch and a fire hose at the same time, right? Nobody does that. So and we need protein. A lot of Americans are not getting enough quality protein. So you want your animal protein to be grass-fed, grass-finished, pastured, chicken, and so forth. I also give a lot of vitamins and mineral supplements, but also I want people to get as much as they can from their diet. And then basically the animal-based diet, it just helps reduce inflammation, and a lot of those anti-inflammatory foods can be found in certain fruits, lots of phytonutrients that help with inflammation and help support the immune system and healing, root vegetables as well. So what is regenerative medicine? So the body is able to repair itself. It has all of the internal mechanisms to begin healing and repair. That's why when you sprain your ankle out on the soccer field, all of a sudden you get this swelling. That's the immune system saying, uh-oh, we have an owie, we need to get to work and start going. And that's why all the swelling and some of the pain. Regenerative therapies help us tap deeper into that natural process. Next slide.
Yep.
All right, so I'm going to talk a little bit about ozone. Ozone was discovered in about 1840, and by a German scientist whose name I failed to pronounce properly. And it was actually used to disinfect medical equipment. It is very antimicrobial. It was actually used to cleanse wounds in World War I. Little fun fact. So ozone is not new. It predates pretty much most medications that we use routinely. And there's over, well over 4,000 or 5,000 articles and counting on ozone, different forms of ozone used medically. Prolozone, which is something I use in my practice quite a bit, it was developed by Dr. Frank Schallenberger. He's a MD like myself. He actually went through a trial phase, going through the Institutional Review Board from, which is the governing authority on medical studies, and set up a trial to study his formula. And who's heard of prolotherapy? Okay, so traditional prolotherapy is where you take dextrose, which is sugar water, and saline, sodium chloride, and procaine, which is Novocaine, like when you go to the dentist, and put it in a syringe and inject the joint, and it creates an inflammatory response, much like the one when you initially were injured, to bring all the healing molecules and cells to the area to continue healing. What he did was he actually modified this prolotherapy formula, still using dextrose and procaine, but instead of just sodium chloride, we use a sterilized microfiltered seawater solution called Biocean, so you get all of the nice healing minerals from the earth, kind of like the difference between the Morton's table salt and a true earthy sea salt. And then also he adds in some B vitamins, an activated form of B12 called methyl B12, B complex, and you inject it into the joint, and then you chase it with a syringe full of ozone gas. And he found that people were repairing ligaments and cartilage and tendons, even prolozone muscles. It works great on scar tissue, so my best success with prolozone is actually those keloided scars that people have. Breaks it up and makes the scar appearance much better. Basically, that's what it is. I call it a Cadillac version of prolotherapy. And ozone actually improves oxygen delivery to tissues. I didn't put it on these slides, but I do blood ozonation too, where we take out blood, ozonate it, and put it back in the body. Lots of studies on that, helping with chronic infections such as Lyme or Epstein-Barr, the monovirus, COVID-19 virus, although technically I'm not supposed to say that, but oh well. There's actually articles on blood ozonation and treating COVID-19, Italian article, Brazilian article, and a Chinese article actually, and a few others. But so ozone is a very useful substance, and it is increasingly used in joints and muscles and just chronic pain issues. That looks good. Is that for me? Next slide. Ozonated glycerin. It's glycerin infused with medical grade ozone over the course of time. One of the things that ozone does is it reacts with fats to form something called ozonides, which are reactive molecules to create that inflammatory immune response. And with ozonated glycerin, you can use it local, topically, inject it. I actually brought a syringe of the ozonated glycerin formula to treat Owen.
Oh, is that what you had put in his wrist last time?
Yes,
Oh.
yeah. And we put a little bit of procaine in there, and then also some activated B12, and it really helps support tissue repair. So I'm really starting to move also towards a lot of ozonated glycerin to treat patients in lieu of prolozone, although they're both great. Mm-hmm. All right, next slide.
I got you.
PRP. This is what we call an autologous therapy. Autologous meaning we use something that we get from your own body and then give it back to you in a improved form and in a localized area. So we would draw your own blood and spin it. And so basically, this is a lot of docs that do PRP. It depends on what kind of centrifuge you use. The centrifuge is a device where you put the test tubes of blood in and you spin it for a certain amount of time. There's a lot of literature out there about like what kind of protocol you use to spin the blood to get the most platelets. I use a special centrifuge that's actually used to process tissue samples for harvesting stem cells, and it has a special spin rate that your traditional centrifuge does. It has a different rate that most centrifuges use. Most docs that do PRP are actually using the centrifuge that you would use if you were getting blood drawn at Quest or LabCorp. So you don't get as good of a pack of cells in that plasma. And I also do a double spin, 2 15-minute spins to really increase the capture. And then Platelets, the reason why it works is platelets contain a lot of growth factors that can bring healing and repair. Hence why we get a clot when we cut ourselves. And so you can inject platelet-rich plasma into injured tissue and begin that healing process. And you can combine some of these therapies too. I've done a lot of platelet-rich plasma with prolozone. So I just, so the person, instead of 2 syringes of stuff, they get 3. First the prolozone solution, then the gas, and then the plasma. And I especially have had really good results with that combination. All right, next slide. Exosomes. So these are really small particles, really teeny tiny, that are typically released by stem cells. So these are actually from donated tissue. I'm very careful about where I get my exosomes from. The tissue is always ethically sourced, so no aborted fetuses, everything's screened. And they also screen for anything like the mRNA molecule for the coded spike protein as well. So, and these exosomes basically are the communication devices that cells use to communicate. So they communicate growth and repair. They communicate things like hormone function in our body. These are basically messengers in our body. They contain growth factors, DNA, RNA, genetic signaling, proteins. They can even contain nutrients. And basically they kind of direct the repair process of the injured tissue. And also, as a side note, there is some area of investigation of using exosomes to even try and detect early disease, like early talk of cancer, early talk of autoimmune disease, and so forth. But in regenerative medicine, we use it for tissue repair. Next slide. Any questions so far? All right, stem cells. So these cells are rather undifferentiated, meaning they're not necessarily, the communication to the cell is not dedicated to a particular structure like an organ, like a kidney or a heart, just yet. So they have the ability to develop into whatever structure we're looking to heal and repair. We self-renew by stem cells. So everybody's making stem cells. That's how we continue to survive. There's 2 different types of stem cells. We have the autologous, where I can harvest them from your body fat or your bone marrow in the office. And when I do that, I can actually spin the sample myself, part of it, and give you your first treatment that day, and then send the rest of the tissue to a stem cell bank to process it and harvest the cells and nurture them and bank them. And then you have the donated cord tissue products, much like the exosomes. And again, those are always going to be from a very carefully sourced, just like the exosomes. Next. All right, peptides. This is probably one of the most popular things on the internet today. There are lots of websites offering peptides. I encourage people to be very careful if you're trying peptides out, because there's a lot of garbage out there, low quality or just flat out fakes. So peptides are short chains of amino acids, very much like proteins. Proteins are greater than 50 amino acids. Peptides are between 2 and 50 amino acids in a sequence. Much like proteins, they can support hormone function. Many of them help repair the body, and there are a number. I just put a few that I use. This is by no means is all of them. BPC-157 is probably one of the most popularly known. It's one of the components of the Wolverine blend, and it has been studied for repair, tendon, ligament, muscle recovery, strength, gut. It's actually a human peptide. It stands for body protection compound 157. It's made in our gut lining, so all of us are making BPC 157 while we talk here. It's probably my most versatile peptide. It's one of the first things that I use in anybody that has issues, whether it's regenerative issues or chronic disease like Lyme disease. It's one of the peptides are something that I have noticed actually really move the needle for people when it comes to healing and repair and recovery. Thymosin and beta 4 and TB500 are very similar. Thymosin beta 4 is from the thymus gland, which is behind our breastbone. It's largest when we are a baby. So baby in the corner has an extremely enormous thymus gland that takes up a large portion of her tiny little chest. The thymus gland is an immune gland. It's where our lymphocytes come from, T lymphocytes that are huge for repair and recovery and also fighting illness. This one is responsible for wound repair, cellular migration, also can help improve vascularity and blood vessel growth. This one you do want to be careful in certain circumstances like cancer, because there is some literature that suggests that it could increase cancer growth in a setting of known active cancer, not giving cancer. TB500 is a synthetic fragment of TB4. And so some formulas will have TB4, some will have TB500. They're both really great. CJC 1295 and ipamorelin, it's a combination of two distinct peptides that actually increase growth hormone release from the pituitary gland while you sleep at night, which also helps with growth, recovery, repair as well. And that's just a short list of the peptides that I typically use. Next slide. So just in summary, it's always important to remember the foundation and that these tools are just contractors, so we need to give them the proper materials and foundation. Nutrition, healthy lifestyle habits, hydration, sleep, movement, also stress. Stress is a big thing as well. Tools, the tools are going to be the ozone therapies, basically PRP, the cellular therapies, and peptides. And the goal is to basically help our body enhance what it already knows how to do, and just give it more additional support.
I have a question.
Yes.
Okay, so when would you say, like, because there's like PRP, stem cells, peptides. If someone comes to you that has more like systemic issues versus someone who has like a very pinpoint, I tore my labrum, like, how are you differentiating who gets what therapies? That makes sense.
Yes, it makes total sense. And that's a great question. There are a lot of factors that go into that. Some of it are the extent of injury.
Okay.
The more chronic or severe, then you're going to want to really come in and step it up a notch. And then within that realm, also finances too, because some of these therapies are much more expensive, such as these stem cells and exosomes. Peptides aren't particularly cheap either. And one thing I forgot to mention too regarding peptides, you can inject them systemically, subcutaneous with a little insulin needle under the skin. They can also be taken sublingual under the tongue. Some they do for oral capsules too. However, I question the absorption of that, and does it make it intact past the stomach and the liver?
Yeah.
And so prefer sublingual or injectable. You can also inject them in the joints too, which I've done. And sometimes I've actually given people a vial to inject around a joint. Not inject their own joint, I don't have patients inject their own joint. But you can just do the skin near the joint or the area of concern to increase absorption in that area. But to further answer your question, I look at the severity and the complexity. And if someone's really severe, and how much they're able to spend too, because, for example, peptides, you know, if you wanna inject BBC 157 and TB 500 into the knee, I also recommend taking it sublingual or under the skin on a daily basis as well to kind of keep that steady state going into the system. A lot of it, there's not like a precise formula as to who I do what, but a lot of times ozone is a great place to start too. Prolozone S also can be very helpful for acute pain. Say you sprained your ankle yesterday, one of the first things I would do is maybe do some ozone plus minus PRP, depending on the budget. Exosomes, and then you can layer it too. You can start out with some PRP or prolozone or ozonated glycerin, and then step it up a notch down the road and do exosomes or your own stem cells. And then combine it with some peptides. I often will give people some sublingual peptides or something alongside the prolozone as well, to do at home themselves.
Who else has questions for Josh?
Do you think they're using that with professional athletes? You see them play basketball, roll an ankle, and then they're back out there 3 days later.
Yeah.
I mean, I play basketball. I had both ankles taped every day, every practice, every game. And I still roll them every 2 weeks.
Yeah.
So that's back in the day. So I don't know how these guys get back on the court.
I know. But athletes are increasingly doing a lot of these therapies. Pro athletes currently can't do peptides. USADA WADA took that out of the picture for them, which I think is USADA. The U.S. and World Anti-Doping Agencies. Yeah.
Well, there are some that are like anabolic steroids, and they can like there's one for like growth hormone. Like instead of growth hormone, you can take a peptide that will.
Yeah, the CJC ipamorelin is like growth hormone. I mean, increases growth hormone release from the pituitary gland.
Yeah, it like increases like the maximum amount that like naturally you could do, right?
Right.
Okay.
Yeah, and sometimes as we age, we release less growth hormone too, and so it can help kind of kick that up a notch. Also, the BBC 157 is very anabolic too, because a lot of integrative docs will use it for gut healing and repair. It's very good for like that leaky gut that you might have heard of. But also you get better muscle recovery post-workout, and also improved strength. That's why athletes were using it a lot until they took it away, because it really helped them when they had those gut-busting workouts. So I think we should let them use the 157. It's made in the gut. It's not like the traditional anabolic steroids. Yeah. But in these tools, it's almost like a cocktail bar. You can mix a lot of things with endless combinations. So, I mean, people concoct new alcoholic beverages all the time. You have your standards, like a Bloody Mary, but you can just make different combinations. And a lot of these are still investigational. They are, none of these are particularly FDA approved.